Partners involved, and we do this through a one team, one voice approach. Next, I'll go over the control objectives outlined for Ops Period 4 and our stance on those. The first control objective is to establish a plan and be prepared to operate an isolation/quarantine site by the end of Ops Period 4. We have a social isolation facility task force that is working diligently to activate our plan in establishing a facility to accommodate the vulnerable population, like the homeless and less fortunate that are unwell. The next objective is to maintain support and ensure safe operations of essential local government functions. We will continue good communication through our continuance of operations group to monitor improvements and changes in functions in the county and all 4 municipalities. The next objective is to deliver appropriate, clear, relevant, and action-based communications/instructions to public, private partners, and community utilizing the one team, one voice approach. We're working through our public information officers to provide the most up-to-date information from all local, state, and federal resources to provide the appropriate, clear, and relative information. The next objective is to monitor and report economic impacts on a daily basis. We will continue to monitor the economic impacts on a daily basis through our Economic Impact Task Force that is gathering information on the effects this virus has had on tourism, businesses, and government. The next objective is to identify and implement measures to care for the basic needs of impacted communities and citizens, especially vulnerable populations affected by our requirements. We have currently been able to assist 2 prominent locations in the county that help less fortunate with portable hand washing stations to help promote personal hygiene and reduce virus spread. We will be providing more services and logistics as soon as possible through creating a working group to address these basic needs for our communities and citizens. The next objective is to activate and operate the team's alternative processes and facilities for triage, testing, and screening upon approval. So working through our Field Response Task Force and Testing Task Force, they have established and exercised a plan for the Haywood County Detention Center in reference to this objective. These folks have also done the same for essential workers, which are too many to list, but the plan is in place and ready to go for essential staff, triage, testing, and screening. Work with the partners to create contingency plans to address any plausible local situations not already completed. Examples include, but are not limited to, supplemental law, fire, economic impact, mass fatalities, and health and wellness plan. So multiple contingency plans have already been formulated and continued to be created and modified as needed to address these and many other plausible local situations that may arise. The last objective outlined for Ops Period 4 is to establish a responder isolation housing facility that can be stood up within 2 hours of identification of the need. The plan is in place and ready to go for essential staff isolation facility. It is being executed and all arrangements finalized as of now. But if we had the need for it right now, we could make it happen in 2 hours or less. Next, I'll go over the Operations Section org chart. I have a Deputy Operations Section Chief, Bill Miller, who is currently unable to be here due to executing some of these contingency plans. Next up is my Health and Human Services branch with Branch Director Ira Dove. Unfortunately, Ira is unable to be here as well because him and both of the groups underneath him, Human Services and Public Health Group, are out currently reaching out to all of our long-term care facilities throughout our entire county, making sure that they have the most up-to-date guidance on this virus, as well as ensuring proper PPE and helping them with the process and being able to obtain it if need be. The next group would be our Continuance of Operation group, which is led by Crystal Patterson. Unfortunately, Ms. Patterson is unable to be here due to workload this morning as well. Next group is our Law Enforcement group, led by Don Robertson. Thank you, Don. The next group is our Fire and Medical group, which is led by Daryl Henderson. Thank you, Daryl. And then the last group is our community support group, which is led by Mike Street, who is actively working with our call center in order to ensure full operational capacity.
Good morning, Jory Miller, Safety Officer. I'm responsible for the Medical Plan 206 and the 208 safety message. On the medical plan, until further notice, to utilize the County Wellness Clinic, they are still recommending to call the office during normal clinic hours to discuss the nature of your symptoms. Also, they are advising they are currently unable to do testing for COVID-19. On the safety message, how is the level of risk determined for any particular incident or task? Every task we do can be assigned to a different box. High frequency, low risk, high frequency, high risk, low frequency, low risk, and low frequency, high risk. Rarely do we make mistakes on high frequency events. Things we do a lot, we do well. We use a phenomenon called RPDM, recognition, prime decision making. The theory is the brain is an accumulation of past experiences. When the brain gets involved in a task, it scans the hard drive, looks for memory markers. We think, have I ever done this task before? Sure, a bunch of times. Did it end up going right? Every time. So why don't I just do it the same way I did it last time? I bet it goes right. If it goes right, I stay out of trouble. Low frequency, low risk events aren't particularly worrisome. Even if they go wrong, the consequences are minimal. High-risk, low-frequency events, or things that are very risky and done very rarely, we do not have the memory markers to deal with these. COVID-19 is a high-risk, low-frequency event. We have few, if any, memory markers to fall back on, but we do have time to think about our actions. Slow down, think about your actions and their consequences. Keep 6-foot distancing, wash your hands, and be successful. I've also included the most current CDC recommendations on wearing masks. Thank you.
Good morning, everyone. I'm Travis Donaldson. I'm your Logistics Section Chief for COVID-19 Haywood County Ops Period 4. The Logistics Section is utilizing the electronic resource request form to allow for streamlined requests coming from each sections of the team. Each section, please let your groups and branches know that for any resource requests, they must use the electronic resource request form. Please utilize a new form for each service or item that you're requesting. We will be vetting these requests based on your needs, uses, burn rates, and availability, so please be descriptive of items in your request. This ensures that we're maximizing the use of what supply that we do have as we're distributing resources. Please complete these 213s. Completing these 213s also allows us to track our expenses as a single purchasing point. A QR code has been made available within your IEP for you to scan and download the electronic form. As many of you are aware already, the availability of certain PP items is very limited. Please ensure that you're using good conservation methods that still provide appropriate protection for your staff. Our logistical staff has been working constantly to find outside-of-the-box solutions to make sure that we're finding resources to provide the best protection for the teams helping to fight and respond to COVID-19. Please refer to your 205 for any section communication needs or questions. We're utilizing Haywood Alerts and Haywood Internal Alerts to push important information out to responders and the citizens. Johnny Reese is our Deputy Logistics Section Chief, who is also managing our CRDP. Steve Maciano is our IT Unit Leader. Andrew Messer is your Communications Unit Leader. And Adriana Warrington is your Supply Unit Leader. In the Finance Section, Julie Davis is your Finance Section Chief, with Ed Salim as your Deputy Finance Section Chief and Christian Owen as your Grants Portal Manager. Please track your time and activity by your 214, as well as tracking your vehicle mileage, use time, and equipment use time. Thank you, and if you have any questions, please let me or a member of my team or section know.
Good morning. I'm Allison Richmond. I'm the Acting Public Information Officer for this event. There were several key updates this week to inform you of. As you may know, there were 2 confirmed cases announced yesterday in Haywood County of COVID-19, and we will continue to update those numbers if they change. We also want to make you aware that Health Department Director Mark Jabin has been doing some excellent explanation videos to share with the public. We're putting those out on social media channels and on the Haywood County website, and that is haywoodcountync.gov. All of the information that we're putting out to the public can be found there in a continual stream on the coronavirus information page, as well as on the Haywood County Government Facebook page, the Haywood County NC Health and Human Services Facebook page, and the Haywood County Emergency Management page on Facebook. We are continually updating those and sharing consistent information throughout those. Also want to make you aware of the frequently asked questions updates for the stay-at-home policies for both the state and the county that have been published through Haywood Alerts and on the website and social media. As those change or are updated, we will continually post them again to let people know of any updates. And the call center remains open 7 days a week, 8 a.m. to 7 p.m. with Haywood County school nurses and Haywood County library staff. They are manning the phones and doing an excellent job keeping people informed. They can be reached at 828-356-2019. So keep using that number for any COVID-related questions. And then finally, next week we are launching what we're calling Haywood County Cares. It's a campaign to let the public know about the efforts that we are putting forward in the community, some of the good work that's being done, and putting faces to the names of those public servants that are working at this event. Thank you.
Wayne Morgan, Liaison Officer. Good morning and thank you. With your efforts, we're well on our way to meeting this thing head on. We will come out on top. As of today, we have 126 cooperating or assisting agencies. Please, if you do not have a direct contact, let me know so we can get you in the loop. Any agency issues that you might have going on out there, please let me know. Thank you for your service to the citizens of Haywood County.
Good morning, everyone. I'm Travis Donaldson, and I will be your incident management team leader. I would first like to thank everyone that is a part of this response, helping to fight this enemy that we cannot actually see. There are so many people doing extraordinary things that will all contribute to our success. As with any incident, communication is one of our major keys to success. I want to emphasize to everyone that is a part of this response that we must communicate with each other and we must communicate well. We also must communicate well with the citizens that we're protecting. We have to be concise and consistent so that everyone knows what they should be doing or not doing to slow the spread. I want to emphasize our overall goal for our response to COVID-19. We want to safely reduce likely transmission in vulnerable populations while not overextending the burden on our existing comprehensive medical system of Haywood County. Life safety by limiting avoidable disease transmission must be the highest priority to limit serious illness and death within our county. If something that we're doing as a response doesn't help support Haywood County achieving this goal, we need to step back, stop what we're doing, and figure out how we can take what we're doing and get us to our goal. I would like to conclude today's operational period briefing with a quote from our 35th President, John F. Kennedy. "The cost of freedom is always high, but Americans have always paid it. And one path we shall never choose, and that is the path of surrender or submission. Be safe, be kind, be distant, but still connected." Thank you.